Thank you, Scott. On behalf of the Illinois Physical Therapy Association and our president, Dr. Sandra Levy, I also want to extend my thanks to all of you for being here today. As you know, our bill sponsor, Representative Skip Saviano, could not be here with us today, but he sent the following statement for me to share on his behalf. Good afternoon. I'm sorry I could not be here in person at this important event due to a previously scheduled commitment. I am pleased, however, to be the sponsor of Illinois House Bill 4478, which would give the people of Illinois the choice to see a physical therapist for treatment without first having to get a referral from another healthcare provider. I am keenly aware of the important role physical therapists have in today's evolving healthcare system. My bill will improve patient access to physical therapy services, which will reduce overall healthcare costs and give people more choice and control in their healthcare. I know there will be opposition from other stakeholders to this proposal, and I intend to work with them to get this bill passed. While it gives patients greater access to healthcare, it provides safeguards to the public. Educational criteria is prescribed. It requires referral to another healthcare provider if no improvement is made within a finite number of days, and it necessitates immediate referral to a physician should someone have symptoms beyond the scope of physical therapy practice. This may not be easy. Like most legislation, it will require discussion and compromise. I have been involved in many similar pieces of legislation over my years in the Healthcare Licensing Committee and have witnessed more wins than losses. I look forward to working with the Illinois Physical Therapy Association and the American Physical Therapy Association to pass this bill. I thank them for asking me to be the sponsor. Skip Saviano, Illinois House of Representatives. Now I'd like to introduce Demetra John, a physical therapist from Chicago, to talk about how direct access to physical therapy services would impact her patients and her practice.
Thank you. It's my pleasure to be here this afternoon. The lack of direct access to physical therapy services negatively impacts patients by limiting timely care. At least once per month, an uninsured or an underinsured patient turns to me for physical therapy, and many times the patient's complaint is things like shoulder pain, knee pain, hip or back pain, or stiffness. These types of conditions potentially could be managed by a physical therapist with safe and evidence-based interventions such as joint protection activities, body mechanics training, safe strengthening and stretching exercises, and pain-modifying interventions that they could safely do at home. Instead, I am forced to turn them away until they receive a physician referral. Frequently, I refer them to a Chicago-based free health center called Community Health for a free referral. There's often a long delay causing undue suffering for these patients, and I think that's the real reason why we're here today. Direct access will allow us to expedite treatment and reduce healthcare costs. Some examples I've personally experienced include the following. Lack of access. During a training program presentation for a local high school girls soccer team, several of these girls approached me complaining of various lower extremity pain conditions. All were conditions I could have helped them with by providing basic exercises, joint protection advice, etc. But based on current Illinois law, I was unable to give them any specific intervention advice. Delay in treatment. A woman had a sprained ankle, which could have quickly been assessed and safely treated with a physical therapy program. However, she had to wait several months to see a physician at the free clinic in order to get a referral for physical therapy. During this time, she had to unnecessarily deal with chronic ankle pain, ankle weakness, and painful walking. It limited her ability to work and to care for her family, creating even greater hardship for a struggling family trying to make ends meet. Higher healthcare costs. Rural groups, such as the Farm Bureau, are in a position to request and may request pro bono services for farmers who are a group of people who are frequently uninsured or underinsured. I personally want to be involved in programs like this, but this kind of outreach is difficult and costly when this population requires a referral for physical therapy services. In all of these cases, these patients could have visited a personal trainer, a massage therapist, a body worker for treatment. these non-medical professionals have far less educational experience than a physical therapist. Yet patients have direct access to them, and they can do so without the requirement of a referral from a physician. If Illinois had direct access to physical therapy, more sports injuries in our youth could be prevented. A sprained ankle could start to improve in days rather than weeks, and the uninsured and the underinsured could take advantage of the more pro bono services that healthcare professionals are willing to provide. I think that this is a very important piece of legislation, and I hope, we all hope, that our legislators will act quickly to allow people to gain access to the healthcare services they need. Thank you.
Thank you, Demetra. Next, Chris Murphy, President of the Oregon Physical Therapy Association, will discuss the successful implementation of direct access in Oregon.
Thanks, Patty. Patient direct access to physical therapy services has been a reality in Oregon since 1993, when the Oregon legislature wisely enacted legislation removing the mandate requiring a physician referral for patients seeking the care of a physical therapist. Almost 20 years ago, we in Oregon heard some of the same arguments used against our direct access efforts that Illinois legislators are hearing today. Those fearful arguments included PTs are not educated to see patients unless a physician referral is in place, that patient safety will be put at risk under direct access, and that malpractice and liability rates will skyrocket. Today, I'm here to tell you that none of those gloom and doom scenarios have come to fruition. We've not had any incidents of patient safety being put at risk due to direct patient access. PT liability and malpractice rates have not increased. Physical therapists today are educated at the doctoral level and are fully prepared to treat patients without a referral. In 2006, the Oregon legislature recognized the public benefit to direct access to physical therapists and further amended our statutes to remove some of the provisions that had been tied to it in 1993. This patient direct access in Oregon has allowed for some innovative and cost-effective models of patient care that are simply not possible in those states that don't have this access. I'd like to share a few examples of some of the things we've been doing in Oregon. Over the past 3 years, 2 hospital systems in the Portland area have worked with Intel, the largest employer in Oregon, and their health insurers on a more efficient pathway of care. Intel wanted to apply the lean manufacturing principles to healthcare and manage costs associated with musculoskeletal ailments. Patients are triaged, and if identified as uncomplicated, an appointment is scheduled within 48 hours, with an emphasis on active treatment and self-management. Intel has seen time lost from work decrease considerably in this time, and their imaging costs, diagnostic imaging costs, are down greater than 30%. The project's so successful that other health insurance companies wanted to model it. The Oregon Health Leadership Council is a coalition of the largest health insurers and health systems in Oregon. And inspired by the success of the Intel project, they launched a 2-year pilot last month, under which the 7 largest insurers in the state will be beginning to provide reimbursement for direct access for care for low back pain. The evidence supports that early access to physical therapists in treating these conditions is a way of improving patient experience and outcomes while decreasing the cost to deliver these services. As our payers have recognized, they get a lot of value in getting their patients, their customers and our patients the right care at the right time. Our experience in Oregon shows that direct access is a model that works well for our patients, and I'm sure it would be the same in Illinois.
Thank you, Chris.